Hey guys, Dr. Brad, Spine Injury Medical. We're going to go over basic core spinal stabilization exercises that we recommend for most people. So, first thing is Superman, back bridge exercise. We're going to do some side planks and then something called dead bug. Some core fundamental exercises for strengthening and balancing the back. So first, Superman. So we're going to get down and do Superman. You would do Superman 2, stabilize the back of the shoulder. So arms out, lift up, hold, and down. And then breathe in, breathe out, hold, and down. You don't really want to do this one very fast. You want to focus on consistency, form, and slow motion. Slow motion is always better for muscles, ligaments, and tendons to help stimulate their strength and growth. The second one we want to do is back bridge. So on back bridge, we're laying flat on our back, tighten the tummy, and you're going to drive the pelvis up into the air. Again, you want to do this generally pretty slow. You can count 3 to 4 seconds up, 2 seconds down. And you're doing about 3 sets of 30 reps. Now, the other thing is side planks. A lot of people work on the core, but we forget about the sides. Side-to-side balance is very important. Side planks help the hips and the lower back at the same time. The basics is keeping the shoulder and elbow in line, feet out, and you're gonna elevate your hip right off the table. Now, if it's too difficult, you can always bend the knees and do it with bent knee. But you have to make sure your body is straight. The shoulder is in line with the elbow, and the shoulder and the hip are all in line. Can't be bent, okay? 3 sets of 30 or so, whatever you can do till about fatigue. Nice and slow, 4 seconds up, 2 seconds back. And then finally, we want to do dead bug. This is more of the abdominal core. Dead bug is also a core stabilization exercise. Bring the legs up. You're going to bring opposite arm to opposite leg, but you want to keep the tummy tight, keep the back flat on the ground, and you're doing here, and lay down, here, but you have to try to keep your back flat. Only you can really feel it arch or not, but if you keep the tummy tight, keep the back flat, typically if it moves far enough, you'll feel the back start to arch up. Then you know you've gone too far. Tighten the tummy. You want to do opposite arm, opposite leg. Focus on having the tummy tight such that the back is flat to the floor while you're doing the movement with opposite arm, opposite leg. If the leg moves down far enough such that the back comes up off the floor, you know it's too difficult. Shorten your stride, shorten your motion. Make sure you keep the lower back to the floor. Good form makes good results. Those are the 4 basic exercises we recommend for spine and core stability. And yeah, you're consistent with that about 3 to 4 times a week. You have a really strong spine. If there's problems with it, even then, it may take some evaluation to figure out what is going wrong.